Hello, we are students with the University of Kentucky College of Pharmacy, and we have partnered with the NEST to provide some health information. In this presentation, we will be discussing blood pressure.
So first we're going to go over what blood pressure is. Blood pressure is the force of your blood pushing against the walls of your arteries. The top number in the reading is your systolic blood pressure, or how hard your heart is pumping blood. The bottom number is your diastolic blood pressure, or how hard your heart is working to refill with blood. Why is this important? Blood pressure is used by medical professionals to help determine your risk for a heart attack or stroke. High blood pressure usually has no warning signs or obvious symptoms. And please note that high blood pressure or hypertension can only be diagnosed by a medical professional.
If your blood pressure is outside of the normal range, you can experience a wide variety of symptoms. It's important to remember that if you experience these symptoms, it does not mean that you have high or low blood pressure. Some of the symptoms can also indicate other illnesses, and you should seek medical attention for a diagnosis. We will talk shortly about what normal numbers are, but for now, let's look at how you feel if your blood pressure is too high. You can experience a headache, nosebleeds, and fatigue. And some of the more serious symptoms are confusion, vision problems, chest pain, shortness of breath, and an irregular heartbeat. You should seek medical attention if you experience any of these. Low blood pressure symptoms are very different. These include dizziness, nausea, cold and clammy and pale skin, and dehydration. The more serious symptoms include blurred vision and fainting.
Here we have listed what normal blood pressure readings are. For the top number, or systolic blood pressure, we want that number to be between 90 and 120. The diastolic, or bottom number, we want to be between 60 and 80. If you are doing blood pressure readings at home, be sure to document the date and the reading you received. If your blood pressure is above 140/90, please seek medical attention from a healthcare provider or your primary care physician. Remember, only medical professionals can make a diagnosis.
Pharmacists are the most accessible healthcare providers, and you can reach them with a phone call or by entering a pharmacy. Many pharmacies have automated blood pressure machines that are available to the public, and some locations even have manual blood pressure cuffs that pharmacists are trained to use. Once you have a reading, the pharmacist can help to determine if you need to be seen by a provider. A pharmacist can also give you tips for lifestyle or dietary changes that may help to lower your blood pressure without medication. These recommendations should not take the place of any blood pressure medication prescribed by your provider, but should be used to boost your overall health. There are several pharmacies located near the nest, and we have some listed here.
Thank you so much for watching our presentation today about blood pressure, and be sure to check out our channel for information on other common health conditions.